Hi, my name is Catherine West, and I'm presenting a campaign for Black women and breast cancer. First, I'd like to address the issue. In 2013, estimated 27,060 new cases of breast cancer are established, expected to be amongst African American women under the age of 45 years old. This statistics, or this just a ratio, is very alarming. It's scary in the fact that we are still having an issue with breast cancer, and there are preventive measures, or at least knowing the signs and symptoms can help prevent the scariness of full-blown aggressive breast cancer. Black women are more likely to have associated with high aggressive breast cancer diagnosis than any other race. This is due to situations of either eliminating people from knowing and understanding why. And this is why I'm starting my campaign or program to address this concern. Our mission is all to get fair care going through breast cancer. Now, the reason why I say this is because depending on the race, economical status, environment that you live in, we should all be treated fairly and should not have to go through breast cancer alone. The reason why this is so dear to me is because the statistics of getting breast cancer is very high for women. It's mostly 3 out of 4 women will get breast cancer. I do know that this is very personal because in the last year and a half, 3 of the women that have raised or been involved in my life have been diagnosed with breast cancer. 2 with aggressive and 1 with not so aggressive. My sister, my mother, and my stepmom. This is why I feel that education needs to be more addressed on how to prevent breast cancer. We need to help women understand that it can be prevented or even diagnosed or helped in an earlier stage. I am addressing the community of the Orlando, Florida communities in the poverty, low-income areas. The reason why I'm addressing this is because this is where I live personally. The campaign is addressing women that have been diagnosed or had history of breast cancer, such as relatives or associated with breast cancer or forms of cancer, or more likely to get cancer also because of generational behaviors that have not been changed. My campaign is to target these Black women in these areas of low-income areas. The 3 issues that I found that were hindering women from getting care was poverty. Orlando Black families are at a 27% rate of the overall population of poverty, which is alarming because with the poverty, there's less resources that are available to you, such as healthcare or good enough healthcare to help you get treatment in an adequate manner. Also, the barriers that I find that are eliminating women from getting help are jobs with hours that allow these women to get to the establishments in an appropriate time. When you have a low income status, you're more likely to work really early in the morning or late at night. Lack of education. These eliminate people from getting good jobs with good insurance. And lack of education is the literacy issue of not understanding if somebody is communicating with them that they have issues or have diagnoses that they might not understand. And with that, a lot of people do not state that they don't understand, so they don't get the right information. A lot of women in this area are single moms, so lack of support, lack of fathers helping them, lack of income. So to get to an establishment is very hard. Also, daycare needs. Women cannot bring kids to the facility in order to get a mammogram, or even some doctor's facilities, because they don't have anybody to watch them while they go get treated. Lack of assistance. A lot of women don't have health insurance in these low income areas. If you don't have insurance, you can't get full coverage to get these treatments on a regular basis for preventive care, or to at least know, which I feel brings a lot of the known issues of why they're getting diagnosed with higher aggressive stages, because they're waiting too long to get the treatment until there's aggressive symptoms that are present. Transportation. A lot of low-income people do not have transportation capable of getting them to these facilities. And even if there is local transportation, they still don't have the funds to support getting to those locations, because they're not necessarily in their vicinity to walk. The last barrier I feel is fear. Always seeing the worst scenario because of family history. Family history prevents people from getting preventive care, because a lot of cultures think that because my mom didn't have it, I won't have it. Or lack of her even understanding that she may have had it and died from it, but they wouldn't have known because of lack of health care. Also, not understanding how to understand how to deal with the diagnosis. A lot of people mentally can't handle it, so they don't even address it or even tell anybody to get the help. The last fear would be racial inequality and social injustice. With the situations in Orlando, Florida recently, such as the Trayvon Martin shooting, the Pulse shooting, and now the high school shooting. These are fears that if people with low income, lack of education, and different statuses go to these centers and help, feel that they will not get the attentive care that they really need. This is a fear because of being treated fairly is not necessarily always happening. And women are feared of being mistreated, given wrong diagnosis, being treated inappropriately because of their status level or economical level. Now, for my campaign, I am going to be suggesting goals, objectives, and methods to get these things done. Preventive campaign would be to get the education out there. The goal to do that is to get volunteers to go out in the community in these areas, to send out flyers, get an observation of the surroundings and what these women have to go through in these communities of low income statuses. The volunteers would be recruited for 2 to 3 recruits from UCF facility campus that need volunteer hours in a health educational field relevant to this type of scenario, such as medical, health education, health directoring, human and resource and health field. The reason why I say to get them in this field is because then they can give their own input and we can get more input on what's new out there for the program. They would go out about twice a month in the Orlando area to send out flyers. These recruits would get self-defense class because some of these areas are not very safe. We do want them to feel safe. Also, they would get information and understand a class on what is being given out to these individuals that we're trying to recruit for this program. Now, the second goal is to work with the local communities, local clinics, health department, and organizations to help us get about 100 women to work in this program for at least 2 years for getting treatment for diagnosis or getting preventive care. The flyers will help with information on how to do self-checks. The program for the clinics would be helpful for the mammograms to get organizations or facilities to open up earlier, stay open later, twice a month, for us to get these 100 women to the locations because of the barriers of hours, lack of daycare, and transportation. We would help them get transportation to the locations within the organizations and the community support and the facilitated volunteers. Also, the last goal would be doing a survey pre-program and post-program. The survey would be giving a question and evaluating from 1 to 5 how they evaluate their emotional need for support for preventive care for breast cancer. And also open-ended questions that would be allowing us to know what particular barriers they had from start to finish of the program, so we can analyze if we can improve or change things during and after the program. This will help us let us know if the program is really being effective in helping these women. Now, the funding of this program would come from community support. We need to find the community in Orlando and the support in the cancer organizations within the state to help fund this program, to see if we can help eliminate these women from being diagnosed with aggressive cancer. Now, the community support, I am going to be implementing cancer runs twice a month or quarterly throughout the year of the 2-year program. These will be paid runs that will be to fund the testing, diagnosis, mammograms, funding to get these women to get the support and treatment they need. Also, we would be doing bake sales monthly within the community of the same area of Orlando in these low-income areas to help get money to keep continually helping these women, such as if they need daycare, food, because the treatment is so aggressive and they can't go to work, to help support to keep their lights on, to help support to keep their rent going, because treatment with cancer is debilitating in some senses, and some will not be able to continue work at a normal basis. So they do lose their normal way of life. And a lot of women will stop getting treatment because they cannot be able to maintain life and treatment. Now, the organizational support will come from organizations such as the National Breast Cancer Foundation. This is a great organization that we will be working with. The organization will help with national mammogram program, which helps get us facilities that give free mammograms, not just the ones that we're working with in the community for earlier and later hours, but just free, totally free. Also, they also support patient navigation programs to help navigate, to help with fees, barriers, and costs that these women go through every time that they are trying to get treatment, care, and preventive measures. So this program navigates women in the organization to help them get with other organizations or other community support oriented departments that can help with cost of treatment, cost of fees for mammograms, costs of barriers such as daycare, rent assistance, stuff like that we may not all get enough money to raise, but this organization will work with us to help continue the process for these 100 women to make sure that this program is successful. The challenges that I feel that we will be going through with this is women wanting to stay in the program. During treatment, and because of the barriers that they already exist, they may get scared and want to stop treatment. When life and behavior statuses change, people tend to either have a flight or fight mode. Some women will fight and continue the challenge and continue with the support, and some will flee because of scared and not thinking they're doing the best that they think they can. With those challenges, we will definitely be here to support them, working with local counselors to help embed in them that the best option is to give as much